Good morning. Today we are going to discuss the laparoscopic dissection techniques. In this presentation, my main aim is to discuss the laparoscopic energy sources. Heat cures when everything fails. It was said by Hippocrates. In old time, when there was no antibiotics, there were no any modern medicine or surgery. At that time, heat was one of the very important modality to treat the different diseases. Still in our household remedies, if we have pain in the knee or pain in the abdomen, your grandmother will come with a hot fermentation just to give you some relief by the heat. And it is one of the important fact that heat was used in the old time endoscopically also. When Thomas Edison has invented the electric bulb, there was a typical tubular projection into that electric bulb, and they were using this type of projection to treat the different anal diseases. So, suppose there is a hemorrhoid, there is a fistula, if there is a piles, then they were introducing this tubular projection into the anus, and the bulb was lighted up and it was heating the anus, and that way they were treating endoscopically. Today also we use seizures, we use flageolet just like the open surgery. Scissors for sharp dissection, flageolet means peanut. You can make it for blunt dissection like separating the cystic pedicles or separating the bladder, it is used. But electrosurgery is the most convenient way of dissection, because always we want to achieve hemostasis before dissection, but unfortunately it is the most risky method of dissection also, and 1 to 2% of all the complication happens due to the use of energized instrument. Energized instrument means instrument in which you are attaching energy. In laparoscopy, you can attach the energy in every instrument. You can attach it into the hook, you can in the spatula, the tritome, you can attach to the Maryland, graspers, aspiration needle. So, before going into the detail of electrosurgery, we should learn some of the principles of electric current, that already you know that current means flow of electron. Circuit means pathway of flow of electron. Voltage means force that cause electron to flow, and resistance means obstacle to the flow of electron. There are two terms, one is electrocautery, another is electrosurgery. Electrocautery is actually wrong term, it is a misnomer, but widely used. Still today we are saying cautery machine, I am using cautery, give me cautery, switch on the cautery, but cautery term is wrong. Cautery was a machine which was used old time back, approximately 15 years ago. Cautery is now no more existing, cautery machine is stopped, company has closed making the cautery machine. Cautery was an old generator in which direct current was used. On tip of the instrument was having a high resistant metallic conductor, and these high resistance metallic conductor has the property that it will make the tip of the instrument hot, and once you will touch the tissue will get burned. That was cautery, and it was essentially application of heat. But the machine today what we are using is not cautery, it is basically electrosurgery. And electrosurgery is high frequency alternating current, and tip of the instrument is not heated at all. It is not a direct current, it is a alternating current. What is the difference between direct current and alternating current? In direct current, poles are fixed, positive and negative is fixed like battery. battery is a DC, direct current. Alternating current is these household supply say. Alternating current, positive and negative is changing. So, in the electrocautery it was a direct current, but in electrosurgery it is alternating current, high frequency, and in alternating current positive and negative is changing very fast, and due to that change in the positive and negative, ions inside the cell vibrates, and due to turbulence of the ion inside the cell, heat is produced directly into the tissue, it is not produced in the instrument. And once the tissue is getting hot because of the vibration of the ions inside the cell, then your electrode will get heated. So, it is different. In direct current, in electrocautery, your instrument is heating the tissue, but in electrosurgery, tissue is heating the instrument. Instrument is cold, it does not have any heat. Once the tissue is heated, some heat is passed to the instrument. This is a typical circuit of our monopolar electrosurgical generator. This is electrosurgical generator. There is a one wire coming. This wire will be attached with your instrument, any instrument you want, any instrument, scissors, Maryland, grasper, knife, hook, needle, aspiration needle, and you touch the body of the patient. Current will travel through the body of the patient, and then it will go to the patient return plate, and again it will return back to the generator. This is a typical circuit of a monopolar current, but there is a big problem of the monopolar current, that if there is any alternating pathway present, current will try to travel through that pathway. Like if patient has rings, necklaces, any ornament, and if it is touching any of the metal part of the table, or ECG, cardiac monitor, pulse oximeter is attached, and they are exposed to the earth, wires are broken, or your surgical operation table is not properly insulated, and the arm or foot of the body or thigh of the body or hand of the patient is touching those naked part of the metal part of the table, then patient will get burned there also, because current will try to jump. That is why before surgery all the ornaments should be removed, and if you cannot remove any ring or any bangle, then with a gauze piece you should wrap it, and it should be protected, so that it should not touch any metal part. Question is, if it is that much risky, that why we are using it and which frequency is safe. Normally in our household appliances, 50 to 60 hertz frequency is used. Frequency means oscillation per second. 60 hertz means every second 60 times positive is changing to negative, negative is changing to positive, that is 60 hertz. 50 to 60 hertz frequency is allocated for almost all household appliances all over world. Even if you will go to the USA, in USA voltage is 110, but frequency is 50 to 60. Even in Asian country voltage is 220, but frequency is 50 to 60. Why this frequency? Because our government wants that we should get electric shock. All the world has decided that people should get maximum electric shock possible. That is why they have kept the 50 to 60 hertz supply, because in 50 to 60 hertz we get electric shock. And what is electric shock? Electric shock is a burst of action potential. If you remember the MBBS second year, for any conduction of the electricity through the nerve or the muscle, there should be action potential. Action potential means permeability of the ion through the cell membrane. If potassium come out of the cell, chloride enters, and again chloride out, potassium enters due to No, sodium and potassium both, but intracellular concentration of potassium is more. So, that is why it comes out. Let us take sodium also, it does not make any difference, but intracellular concentration of potassium is more. So, it comes out and chloride enters. Then what happens? Permeability of the ion through the cell membrane will allow the conduction to flow to the tissue. Now, at 50 to 60 Hertz frequency, this permeability of the ion of positive and negative ions is very fast, because once outside is positive, it will pull all the negative ions outside the cell membrane like chloride, and even outside is negative, it will push the chloride in and it will pull the positive ions, that is sodium and potassium. So, due to this permeability, there will be a massive burst of action potential. Our entire nervous system will get excited, and that is called as electric shock. And your brain, you shout, you will touch it and you will shout that, oh, I got electric current, and this is a protection. So, that even if you are sleeping at night and suppose your fan is defective, it has electric current, and if your foot is touched, you will suddenly awake and you will pull your foot, you will save yourself. But if frequency is increased to 100 kilohertz, then muscle and nerve no more will contract. There is no any effect of electric shock. Without any electric shock, tissue will damage, and that is risky, because without your awareness there is burn. Why at this frequency muscle and nerve stimulation ceases? 100 kilohertz means 1 lakh hertz, that is 100,000 hertz. At 100,000 hertz, there is no more permeability of the ion through the cell membrane. Reason being that frequency is so fast changing that ions are confused at where to go. When outside is positive and chloride just about to move, this positive is negative, and just about to go in again positive. So, it is completely cannot move. Just like if you will hold the arm of someone and you do like that, he will just vibrate, he cannot move either this direction or that direction, because your frequency is changing so fast that there is no time for the ions to move. By the time ions started moving, again it get pushed in, and again it started going in, again it is pushed out. So, this is called as turbulence, and no conduction and no electric shock. So, that is why I told our government want that we should get electric shock. That is why they are fixing everywhere in the world 50 to 60 hertz. So, that you are aware of the current and you will protect yourself. If the frequency is further increased 500 kilohertz to 33 megahertz, so 3.3 megahertz, sorry, then you are absolutely safe. Even SA node, gray matter, blood cells, lymph, all is safe. There is no any bad effect, but unfortunately, some of the Chinese company, they are selling very cheap quality electrosurgical generator. Cost is $200, $300, and those generators are available now in the market because of the cost. And what happens in this generator? In this generator, there are some unfiltered low frequency current. So, when you are using it, 99% of the frequency is above 100 kilohertz, 1% of frequency is 50 to 60 hertz. So, you will use the current in the gallbladder and the foot of the patient will contract, or patient leg is twitching, that means machine is bad. And if you will continue those generator for 15 to 20 minutes, you will see tear is coming from the eye of the patient is crying, because you are punishing the patient, you are exposing the patient to electric shock. Any analgesia cannot prevent the electric shock. Analgesia can relieve the pain, but no shock. Patient muscle is paralyzed, otherwise he would have slapped you, because if anybody will give you electric shock repeatedly, what you will do? And at the end of the surgery, there is a stage of amnesia. Patient does not remember what happened during, patient is exhausted, patient face is pale, he feels very much weak, and if you will try to give the round at evening that get up now, your surgery is over, you can go, they will say no, I do not feel like, because you have used a bad frequency. So, it is a cruelty. When you go to buy electrosurgical generator, you should buy the highest frequency generator available, but cost you have to pay more. If you will buy a simple electrosurgical generator which has 100 kilohertz or maximum 500 kilohertz, then you will get it for 1 to 2 lakh rupees. If you will go to buy little more frequency, that is called as a radio frequency generator, it will cost you 4 to 5 lakh. And if you want to buy further high frequency like 1 megahertz, 2 megahertz, 3 megahertz, that is called as PK generator, that is plasma kinetic generator, then it will cost you approximately 10 lakh rupees. Why should I buy higher frequency? Higher the frequency, with less wattage of the current, you can achieve the same effect. If you have a simple electrosurgical generator that costs you 1 lakh rupees, and if you have to do the ovarian drilling, you need 40 watt current. If you get a little more higher radio frequency generator, then it will need only 20 watt current. And if you will go to the high frequency, ultra high frequency plasma kinetic generators, then it will take only 5 watt current. Just like sharper your knife, less force is required to cut. So, higher the frequency, less wattage is required to cut. So, whenever you buy, always ask the company that tell me which frequency you are going to offer me, and they will say that it is a 100 kilohertz frequency, and do not buy this. Less than 100 kilohertz, if they are themselves saying 100 kilohertz, that means it must have the sum of the impurities which is below 100 kilohertz, and below 100 kilohertz means household appliance frequency, and household appliance frequency means this current, and this current if you are putting into someone, you can understand how he will feel. So, high frequency electrosurgical generator has to buy. More than 3.3 megahertz is also not good, because at this TV signals are produced. So, it will not give any effect to the body, it will cross the body, and moreover the screen of your monitor will start flickering. So, if question comes that what is the ideal frequency for electrosurgical generator in the laparoscopic surgery or open surgery both, then the answer will be 500 kilohertz to 3.3 megahertz is the ideal frequency. 500 kilohertz to 3.3 megahertz is the ideal frequency which is used in the electrosurgical generator. And if question comes that which frequency is the best, then in between this, whatever you will see higher, that should be the best. If it comes 3.3 megahertz and it comes 500 kilohertz, then do not think 500 is more, 500 is kilo and 3.3 is mega. Mega means 10 to the power 6, kilo means 10 to the power 3. So, higher the frequency, I have bettered the generator. Sharper your knife, easily you can save your, otherwise not. Now, burn is equal to intensity of the current into time by area. This is a frequency of electrosurgery. Burn, which the tissue you are burning, is equal to intensity of the current. Intensity of the current means number of electron. number of electron, if it is increased means ampere is increased, and if ampere is increased means wattage is increased, because watt is volt into ampere, voltage is fixed and ampere is increasing, that means watt is increasing. There are two type of machine, one is normal, another is underwater. If you are buying a simple electrosurgical generator, they will ask you, sir, which watt you want, you will ask the 250 watt I want, then they will sell you 250 watt generator, it is written on the machine 250 watt, and with the 250 watt you can do laparoscopy, open surgery very nicely, but 250 watt you cannot do hysteroscopy or TURP, because you have to work in hysteroscopy under fluid environment. So, if you have to work under the fluid environment, you need 400 watt generator, that is little big, because when you work under the fluid, a lot of electron is taken by the fluid also, it is dispersed here and there. So, that is why you need more wattage of the current, is not it. So, this is for simple electrosurgical generator. So, if it is 250 watt current machine, and if there is a knob and that knob has a point 1, 2, 3, 4, 5, 6, 10, then 1 means 25, 2 means 50, 5 means 125, and if I put 10 means I am getting 250, and if it is 400 watt machine, then 1 means 40 and 10 means 400. But in good machine, it is written already digitally how much watt you are using, and 40 watt of normal electrosurgical generator is equivalent to the 20 watt of radio frequency generator. All are electrosurgical generator, but all does not work the same. It depends upon the company which you buy. If you will buy the Covidian popular model like Force FX, that has high frequency. If you buy the gyrus PK gyrus, that is from Olympus, that is plasma kinetic energy, and those are very good. And it is expensive. These are plasma Olympus, plasma cutting forceps, PK technology of gyrus group. So, it is good, you can afford, you can buy. So, more money, better machine generally. Now, another variable is time. If you press the pedal for more time, you have more burn. If you press the pedal for less time, you have less burn. Just like when you are ironing your cloth, and if you have a very delicate cloth, polyester, silk, you are moving it fast. If you will move it slow, it will burn. So, if you want to prevent burn, either use intensity less or you decrease the timing. So, suppose your energy is 20 watt set and you are cooking the fallopian tube, stop, stop. But if you are same wattage, if you are holding the round ligament, then in one go you should go 3 seconds. Because if you are ironing your jeans pant, you have to move your iron slowly. Otherwise, in the iron machine you have a setting of cotton, so that it is very hot. But same setting if you will use for your polyester or silk cloth, it will burn. But suppose your iron does not have this control, then what you do? You put some water over the silk and then move it fast. Do not keep and talk with someone, otherwise it get a stick burn. You are seeing in the movie, they are burning the cloths by talking to someone. Why? Timing is more, heat is more, there will be complete burn. Inside the abdomen, we are not going to burn the tissue, we are going to cook the tissue. So, if it is burned, it bleeds. How? I will tell you later. So, intensity of the current and the time is directly proportional and the area is inversely proportional, and most of the complication in electrosurgery happens due to this area. If area is narrow, burn is more. If area is more, burn is less. So, what happens? Let us assume that you are doing a cholecystectomy and here is a gallbladder. This is cystic duct, this is a right and left hepatic duct, this is common hepatic duct, and here is a CBD, and this was a cystic artery, and you were doing the surgery. This was right and left hepatic artery. You are doing surgery and suddenly bleeding started. Due to any reason, right hepatic artery avulsed and bleeding, and you are panicked. As soon as we see the spurt coming, started palpitation, and we are anxious to stop the bleeding. You bring the monopolar Maryland and you catch a bunch of tissue there. You are holding a bunch of tissue and trying to cook it. In the panicky, you are holding a big piece and bleeding stop. Now it is cooked, bleeding stop. You take a deep breath that now I am safe. You discharge the patient. Within few weeks to the few months, patient returned back with the jaundice. Ultrasound shows that there is a increased hepatobiliary tree pressure, there is bile stasis and there is obstruction. Why? This area will get a stricture and the patient has a stricture here. If less stricture is there, you give some antibiotics, you give something, you give some of the bile salt so that it will be liquefied, and patient has, our own body is best healer, it will heal. If it is a little more stricture, you will send the patient for ERCP, they will put a stent or dilate the stricture, it will cure. If it is still more, you have to do hepatogynostomy. Patient CBD has to cut and it has to be anastomosed with the bowel, that is hepatogynostomy. Now, question is why it happens. The reason of being is that once we started doing surgery, then ultimately the current has to return to the patient return plate. So, how it will return? That here is the lever, this is the lever. From the lever it has to, all the electron which has there, it has to jump to the common CBD. From CBD it will go to the common hepatic duct. From common hepatic duct it will go to the liver. From liver it will go to the latissimus dorsi. From there it will go to the psoas. From psoas it will go to the buttock. From buttock it will go to the patient return plate and it will go into the generator. And in this entire pathway of circuit, heat will be maximum where area is narrow. So, this is a big area and this is a narrow area, and narrow area has maximum resistance. Suppose something goes wrong in this room and all of us have to escape this room immediately, where will be the maximum resistance? On the door or on the stair, because it is narrow and someone may fall, someone has a problem. So, electric current is in entire all the wire of this building or any building has electric current, but why these bulbs are only lighting? Because they have the narrow area, they have a small filament, and once the electron goes to the narrow area, they are very angry, because if you will give resistance, it will start producing heat. Just like us, if someone resist, then we cannot tolerate, we start producing heat, we are angry, and that heat is more wherever minimum resistance is there, maximum resistance is there, heat is more, and then this happens. Suppose you are a gynecologist and you are doing the total laparoscopic hysterectomy. This is uterus, here is the uterine artery, this is descending, this is descending cervical, this is uterine artery, and then this is ureter going. Ureter has one big problem, that it has very high concentration of normal saline, and normal saline is a fantastic conductor of electricity, and suddenly you are cutting it, but at the time of cutting it there was not proper secured and bleeding started. Once the bleeding is there, you get the Maryland from other side, not also from the same side. If it is same side, it is little less risky, because tip will be pointed towards the cervix, but you bring it from other side and you are cooking it. It is cooked, and do you know what is the incidence of ureteric injury in the total laparoscopic hysterectomy? 4.3%. It is published in the Lancet Journal of Obstetrics and Gynecologists, although it is an old publication, 1997. From 1997 to now this 2015, a lot of new generator is available, but still that publication stand in every book, that incidence is 4.3%. Most common cause of the injury in the total laparoscopic hysterectomy is ureteric injury. You feel what also, you must have seen also. So, why it happens? Because ureter has normal saline, it is a very good conductor of electricity. It will attract all the electron, come I will take you where you want to go, and all electron jumps to the ureter, and from through the urine itself they go to the kidney, from kidney it go to sauce, and sauce it will go to the patient return plate. Suddenly a peristalsis comes, and that peristalsis is sinking, narrowing the ureter, and it will get the burn here, a stricture, and patient has the initial pain, and patient has the other problems. Later patient will go to the gynecologist, gynecologist will try to paint it, and then the patient will file the complaint. I will show you, there are hundreds of questions which comes to us like that. I will show you any of one, like let us say this: while doing hysterectomy, my both the ureter are damaged. Till 6 months of period, the gynecologist kept me in dark. It finally all ended when my whole body was swollen, and government hospital urology department did a ileal surgery in which 20 centimeter of my intestine is cut and replaced. Now I have restriction of passing the urine every 2.5 hours. Every 4 month follow up for lifetime. The picture is very clear that this has happened while doing hysterectomy. The gynecologist first was mentioning she is guilty, but when asked for compensation, she said it is not at all her concern, and I may have the tuberculosis of ureter or kidney. On this, government hospital doctor clearly gave a letter saying that there was no symptom of TB. I have already forwarded all the letter to you. Urologists have been keeping a record of my cases. They have done presentation for seminar on my case also. So, this is how. Answer is simple. Answer is that even if you will go to the consumer court, nothing happens, because it is not a negligence, it is a complication. And if the gynecologist has license to practice, you cannot ask for compensation, if it is presented in correct way. Anyway, this is the medico legal thing which I will discuss later sometime, that how to prevent medico legal from you. But my purpose was to tell you that it happens. Ureteric injury is one of the most common injury, and it happens due to the use of wrong use of electrosurgical. Now, question is how to prevent it. How to prevent it? If you want to prevent it, you should keep in mind that you should never hold a big amount of tissue at one time. If it is bleeding, you should always try to hold the minimum amount of tissue, that much only, tip of the bleeder. Don't hold a bunch of tissue, hold a completely tip of the bleeder. Do you know, in every house there is one fuse, main fuse, or in every appliances there is a fuse. In TV there is a fuse, in the fridge there is a fuse. Every fuse is a small fuse. Fuse has a very narrow wire inside. So, if anything goes wrong, this fuse will blow and your appliance is safe. That is why the fuse is used. But suppose this fuse is repeatedly blowing, and you bring a thick wire and apply in the fuse, and then apply the, let us see how this fuse is blowing now. Fuse will not blow, your entire house will burn, isn't it? Exactly same way, if bleeding started and you are holding a bunch of tissue, everything together, let us see how the bleeding happens now. I will cook, sab kuch jala dalunga, I will cook everything. Then at that place heat will be less, but at somewhere it is burning, because as soon as you hold a big tissue, your amount of the heat where you are holding will decrease, and elsewhere burning. So, when you are using the monopolar, never ever hold a bunch of tissue, just you should try to hold the minimum amount of tissue at one time. This is one important thing. Bleeder point, take your time to define the bleeder point. Do not be in hurry. If it is bleeding for 2 minutes, nothing will happen. You are a surgeon, for bleeding you should not become panicked. You should try to little bit explore and try to define the bleeder point first, and then catch the tip of the bleeder. And if you are holding a minimum amount of tissue at one time, then maximum heat will be where you are holding, and there will be no remote injury. This is called as remote injury. Injury beyond the field of vision is called as remote injury. This is one. Do not hold a bunch of tissue. Another, that is why we are dissecting, that is why we are skeletonizing the structures.
As the area increases, the burn will be less.
Yes.
Inversely proportional.
Yes.
Because we are using more current and more energy.
No, if area is more, burn is less, because if area is more, there is no resistance.
So the area is more when you are holding a bunch of.
Yes, then there will be no burn. Where there will be no burn? Where you want, where you are holding. But wherever at any other place there is a narrow area, that will burn. You got my point? So, if area is less, wherever burn is less, just like these filaments inside the bulb is narrow, they are burning and thick wires are not burning. So, we should give ourselves a small area, then more heat will be where we are planning to give, we want to give the heat. But if you will hold a big area, heat will not be produced where you want, it will be produced where you do not want. Current itself will find out some narrow area somewhere to burn. Just like current itself is finding these bulbs to burn, because these are narrow area. They know that this area is problem if you will go, so let us burn this area.
Sir, how much would be the maximum amount of the tissue that we are supposed to hold? I mean, 5 mm.
You know, it depends upon many factors, that I am coming to those points, depends upon the type of tissue also and the energy sources what you are using. So, I will discuss that in later slide in the same presentation. You do not have to only know the amount of area, you have to know the type of tissue, you have to know the frequency, and you have to know the type of current you are using, like desiccation, fulguration, coagulation, that I am coming to that point. Then this also true, hold true for bipolar, but remote injury it does not happen in bipolar. But more heat if it is narrow area, if you will hold a small tissue, more heat will be produced, that even in the bipolar. So,
the narrow area which is burning after holding a bunch of tissues is the closest area where we are.
no, it is not necessary. Anywhere in the body. Even suppose you are performing surgery in the neck, and a toe of the patient, a skin of the toe of the patient was touching the table there with a narrow area, that also get burned. If patient is wearing a finger ring, and if this is touching some table, this is a narrow area, finger will get burned. Anywhere, even inside the body, I am coming to those points, I will show you the pictures, and it get burned. Because heat is maximum wherever area is narrow. So, first is to we ourselves try to give a small bunch, not whole bunch of tissue, hold a small tip of the bleeder, and second, we should use the minimum wattage of the current required, minimum wattage of the current. More than 80 watt is never used in laparoscopy, and ideally 40 to 60 watt for normal electrosurgical generator, and if it is a good quality radio frequency generator, then 10 to 30 watt of current is used, and normally maximum 80 watt of current, depending upon the quality of your machine what you have. So, this is called as remote injury, and remote injury is one of the big complications. So, we should always remember this equation. What is equation? Burn is equal to intensity of the current into time by area. Like you are doing hysterectomy, this is hook, and you try to cook the tube, and a portion of the surface area of the hook is touching, and it is burning there. Now, there will be a problem. So, here we can see this is the uterus, this is fallopian tube, this is तो operation 2 ही बजे रख लीजिए. So, this is the, and here is the hook, hook is a monopolar, and not only the tip, entire body of the hook is also touching the uterus. This is a large surface area, and this entire thing is touching the uterus. And now, this fimbrial end of the tube is touching the bowel, and this is a narrow area here, and it will get burned. And once it is burned, ठीक है, या फिर 3 बजे कर लीजिएगा. So, this, and it will get perforated, and after 2 days patient will have the peritonitis. You will swear that I have not touched the bowel also, I did the tubectomy only, but the patient has a perforation 2 days later, because electric current, once it burns, at that time it looks just like a whitish scar. But electric current has a bad property, it goes through and through, complete, penetrate deeper. Just like once electric shock patient comes to you, it takes months to heal. If you are doing cholecystectomy, it can damage. If your thigh is touching the patient, it can damage, and these all type of complications can happen. So, this is called as remote injury. Sometime at the place where you are attaching the patient return plate, that also can injure. Like if the thigh of the patient, if the arm of the patient, if the waist of the patient, you are attaching the patient return plate, it can get injury. Do you know why? You should always choose the well vascularized muscle mass. Sometimes we apply it in the vascular insufficiency area, like palm, like sole, like heel, where the blood supply is not good. Or we sometimes apply to the bony contour, like here orthopedic surgeon has applied it on the medial condyle, and it is a small bony contour is burning. So, sometime your patient is in the lithotomy position, your patient return plate is just below the buttock, but when you are pulling the patient, it has displaced below the halosacral curve. And once it is below the halosacral curve, now only the margins of the patient return plate is touching like that, and it will get burned. Patient return plate are of many types. There is metal, there is silicon, and there is adhesive. So, metal are risky because margins are narrow. So, that is why if you are using metal type, you should wrap it with the gauze piece, a sponge, and put some saline. So, ideally metal type has only one advantage, that it is completely reusable, you can use every time the same. This is metal type of patient return plate, but it is not good, you should use the silicon type. Silicon has the advantage that it can take the shape of a body contour, and if it will take a shape of a body contour, automatically it get big area. Even if you will put in the buttock, it will get, but ideally you should use adhesive type. Adhesive type has an advantage that even you can apply on the arm, or you can apply on the forearm, or you can apply on the, like here this is applied on the arm, you can apply on the waist, you can apply on the thigh, and it has a 2 silver plate with electrolyte inbuilt, and this silver plate will give you the good surface area, like if it you can apply this way, that is all. And now you do not have to care anything, automatically this 100 square centimeter area is there, and there is no chance that it will displace. It is single use, this is the only problem, and it is little expensive, but it will guarantee that the patient return plate does not have any injury. So, this is the patient return plate applied only in this narrow area on the sacral promontory, the metal part of the corner of the patient return plate was touching, patient get burned. If you have 100 square centimeter, 100 square centimeter is not big, 5 into 20 centimeter, this was just 5 centimeter and 20 centimeter, or 10 by 10 is 100 square centimeter. Then you do not have any fear of burning at the patient return plate. You can see in this picture, patient return plate electrode is thin and patient return plate is big, so that there is a heat produced at this point as well as at that point. But in this we have a large patient return plate, so there is no heat at the patient return plate site, and your patient is safe, because wherever the area is large, heat is less. But if your patient return plate is displaced and only corner was touching somewhere, it may burn at the place where you are applying the patient return plate. Bipolar does not have this problem. Do you know why? Because scientists they saw that if they have to perform surgery in the axilla, then apply patient return plate in the arm, so that current has to travel that much only. If you are performing surgery in the axilla, then do not apply the patient return plate in the foot. So, it has, this is very important, like here. So, what it is done, that you have to try to apply in a way that it should be nearest to the body surface where you want to operate. So, the question is, why not to bring the patient return plate inside the body of patient itself, and that was the concept of bipolar. In bipolar, there is no need of patient return plate. Even if you will attach the patient return plate to the patient, if you are switching your machine to the bipolar, from inside itself it is cutting off, it is not connected. And in the bipolar, one pole is active electrode, other pole is return plate, and it is changing. So, in bipolar, even if you want, remote injury cannot happen, because current can only travel in between the jaw. If you will not remove the ornaments, if you will not remove the necklaces, if the patient thigh is touching the patient, if patient the arm is touching the patient, no problem, bipolar is safe. It is a modulated current, it does not go here and there, it is disciplined. Electron only flows in between the jaw. Some people they say bipolar behaves like a happily married couple, monopolar behaves like an unfaithful bachelor. There is wherever area of least resistance, they will try to deviate, but in bipolar, positive is taking care of negative. Where are you going? Electron cannot go anywhere else except in between. That is why it is safe. You do not have any chance for remote injury in bipolar, absolutely no remote injury, but there is another problem with the bipolar. The problem is bipolar does not cut, bipolar only coagulate. Only one type of bipolar cut, that is a PK energy. If you increase the frequency too high, then bipolar cut. Otherwise, by default, simple radio frequency energy or simple this electrosurgical generator, bipolar does not cut, it only coagulates. This is first drawback. Second drawback of the bipolar is that collateral damage for same wattage of the current which you are using in the monopolar is little more. Now, what is collateral damage? Collateral damage means, suppose this is a tissue, and here is, this is one electrode, and here is another. Normally, if you will use 100 watt of the current for approximately 3 seconds, there is a 6 millimeter collateral damage. What is collateral damage? It is a lateral spread of heat. Just like if you will take a metal pin in your hand, hold a metal pin by finger and use a candle. The kids are always doing this experiment, they love those things, and they will hold a metal pin and put the one end of this pin over the candle and see what happens. Immediately nothing happens, but after a few seconds you get heat, you will drop the pin. Why immediately nothing happens? Because heat could not reach you immediately, it goes collaterally, takes time to reach there, one to another, another to another. This is collateral damage. Exactly same way, when the current jump in between the jaw, there is a collateral damage just at the place where in between the jaw where you are applying. In the bipolar, sometime amount of heat generated at this is approximately 300 degrees centigrade. if you are using 100 watt of current, then 300 degree centigrade in between the jaw, approximately 3 millimeter lateral there is 100 degree centigrade, and approximately 6 millimeter lateral there is a 55 degree centigrade. This is 55 degree centigrade. So, this is the collateral spread of the heat, that is called as collateral damage. And up to 6 millimeter, up to 55 degree centigrade, as you know, 55 degree centigrade heat cell cannot tolerate, they are dead. In monopolar, if you use same wattage of the current, this is electrode and patient return plate is here, and current has to travel that much from here to there. So, during that travelling intensity decreases, and for same 100 watt of current if you will use for 3, it is only 3 millimeter. Collateral damage is little less if the same wattage you will use, yes, compared to bipolar. Just like husband and wife, they fight more compared to girlfriend or boyfriend. Reason being, you are too nearer to each other. For simple reason, there may be big problem. In the morning, you are for breakfast, she will give you the breakfast, you will see what is this rubbish, anybody cannot eat, and she will say whatever I will make you will never like. Now, your attitude is changed, you are not the same who was before. Problem starts, there is a fight, your mood is upset. Before the marriage, the same people, they do not fight that much, reason being not frequently meeting, far away, only by the phone or sometime by the other media, your distance was too much, but here the distance is too nearer. But collateral damage is good, because I can control the collateral damage. I can control this collateral damage. If you want to not fight with your spouse, if you want a happy family in your life, then you should be low in intensity and intermittent. Like if you have to, if you do not like the breakfast, you do not shout, what is this rubbish you have. You should say that this can be made better than this. You can definitely make it more better if you will try. If say no, I do not have time to do this, then do not speak at that time. After 15 minutes, you can say that let us try, see you will do it. Then there will be no fight. The reason why we are fighting is intensity is high, and we are continuous, one bombarding from here, another from there, another from here, and that increases the intensity. And then collateral damage, even the collateral damage means neighbors are also listening what is happening, they started fighting, whole building will know that it is started, that is collateral damage. But collateral damage is good because it is visible. So, what you do, simply decrease the intensity and decrease the timing. If you will tell someone that Dr. Mishra has told that bipolar has more collateral damage, they will say he does not know anything, it is wrong. Bipolar has less collateral damage, and actually it is true, bipolar has less collateral damage. Why? Just like if you tell that husband wife fight more, every husband wife does not fight. Bipolar has less collateral damage, and this is true, because you have not told the other half of my sentence. Bipolar has more collateral damage if you use same amount of current and same timing. Do you know neurosurgeons are also using bipolar, but do you know how much watt they use? 2 watt, 3 watt, maximum 5 watt of current. So, they decrease the intensity. It is in my hand. If I do not want to fight, I will not speak, there will be no fight. I will keep my volume less. So, if bipolar you are using, you have to use less wattage of current, 1/3 less watt of current. If you are using monopolar with the 40 watt, in bipolar maximum 12 watt or 13 watt is sufficient, and another timing should be less. Never press your paddle more than 3 seconds in one go. 3 seconds is 101, 101, 101, and minimum 1 second. 1 second is 101, like this is 1 second, and this is 3 seconds. So, what you will see that water start bubbling and vapor started coming. That means it is cooking. It should never give you the black smoke. If you go to your kitchen and if you see that smoke is coming, at some place white smoke is coming, that means it is not a smoke, it is a evaporation of water. That means it is cooking. At some place you are seeing the black smoke is coming, that means it is burning. So, if you will press more than 3 seconds in one go, it will start burning. We are not allowed to burn the tissue, we are only allowed to cook the tissue. So, bipolar collateral damage can be minimized by using the less time and less wattage of current, and that is why it is good. Monopolar, their direction of the electron is towards the penetrant plate, there is no in between the jaw. So, it will not be local, it is remote, and remote injury is invisible. Just like if someone has any affair somewhere, it is invisible. It gets visible only when complication happens, otherwise not. 90% of the monopolar injury is hidden, nobody never know. 90% of the time which complication we use by the monopolar, body itself is just hiding it, okay, it was done, let us repair it, doctor was foolish, he has burned it, we will repair it. But 10% of those, once the complication happens, perforation happens, stricture happens, then it comes into the clinical picture. But in bipolar, collateral damage always is visible in front of you. It does not have any problem of the invisibility, always it is visible, because you are not hiding to anyone and it is local, there only. And in the monopolar, injury is remote, somewhere else, which is invisible, and that is why we do it. In bipolar, timing is important. In monopolar, even for few seconds if you will use, it can burn, because anywhere if the narrow area is there, it can burn within few seconds, even the timing is less. This is the problem which is important to keep in mind, that bipolar is always safe as far as the remote injury is concerned. So, this is second problem of the bipolar. First problem was that it does not cut, second problem is for same wattage, same type of current if you will apply in the bipolar, it has more collateral damage. So, we should not do that. Third is, every instrument cannot be bipolar, every instrument can be monopolar. You can use scissors also as a monopolar and a needle also as a monopolar, but bipolar has to be especially designed, that okay, let us make this instrument bipolar. How? From the tip up to the machine it should be insulated, and it should only be naked in between, otherwise it is protected, it is covered, just like human we are covered, animals are not covered, they are monopolar. So, it has to be protected completely, and only current then can travel in between the jaw, and it has to be especially programmed. Scissors cannot be bipolar, because they are made up of metal, and metal jaws has the problem that it may get short circuited from one to another. So, Storz has made one bipolar scissors. Know how they made? This is bipolar scissors. The one jaw is made up of plastic, only the tip is metal, and other jaw is metal, and there is a wire going through this plastic. So, it does not allow it to get short circuited. So, this is, but this is metal to metal is not touching, only current is touching in between the jaw. So, this is important, and this is how you can do. So, one is active electrode, another is return electrode, and current only travel in between the jaw. You can use even in the neurosurgery, you can use any small, and there is no need of any protection of the patient. In gynae, bipolar is must, so that you can travel the current in between the jaw. Now, waveform, there are 3 type of waveform which is used. One is pure cut, another is pure coagulation, and third is blend. Pure cut is high frequency low voltage current. Pure cut is high frequency low voltage current. If you have bought a machine who has 100 kilohertz to 500 kilohertz frequency, then when you press the pure yellow paddle, then it will give you maximum available, that is 100% on. And due to that much high frequency, there is a turbulence of ion inside the cell, and that will fracture the cell, cell membrane is ruptured, cytoplasm is burst out, it is evaporized, and that is cut. Because if tissue is evaporized, there is a hole there, there is a deficiency, just like knife. When you cut with the knife, what knife is doing? The sharp edge of the knife is fracturing the tissue, and the fracture of the tissue giving way, and that giving way is cut. Exactly here the tissue is evaporized, fracture, and it is cut, but margins are healthy. Tissue which is in contact is gone, and tissue which is not in contact is life, just like knife. When you cut, margins are healthy, you can suture it by primary closure, and the healing will be primary intention. Another is coagulation. In coagulation, it is a very low frequency and high voltage current. So, there is a spike, big plateau, a spike, big plateau. Only 6% of the time machine is on, 94% of the time it is not working, means one spike. So, there is no turbulence of ion inside the cell. So, no burst, there is a slow movement of the ion inside the cell. Turbulence means this is turbulence, means uncontrolled anywhere, and it is controlled movement, so that cell membrane cannot rupture, only heat will build up, and once heat is going to 55 degree centigrade, protein coagulates, and once the protein coagulates, the tissue will shrink. Then temperature further increases to 80 degree centigrade. At 80 degree centigrade, elastin and collagen of the tissue melt, and then melted elastin and collagen of the lumen of the artery seal together, and that is called as fused lumen. And with this fused lumen, now our hemostasis is achieved. Fused lumen, it is completely bleeding stop, that is called as coagulation. What is coagulation? That is a degeneration of the protein and melting of the elastin and collagen to fuse the lumen of the vessel is called as coagulation. The, if you will, cellular definition or chemical definition of the coagulation is this. If suppose you are holding a tip of a vessel and accidentally you press the yellow paddle, that tip of the vessel is fractured and you have more bleeding, and you do not have now any vessel to catch also, it is undermined, now tip of the vessel is fractured. And reverse is also true, sometimes you have to cut. Some people what they do, they cut the muscle by the coagulation current, and they say, you know, I have developed this technique of cutting the coagulation current. You will say, why you are cutting the coagulation current? They will say, no, no, it is very good, you will not have any bleeding. and it is true. If you cut with the coagulation current, there will be no bleeding, because margins are, vessels are, capillaries are, venules are cut and coagulated. But it is bad, because if you are cutting with the coagulation current, there is a burnt elastin, burnt collagen and burnt tissue on the margins, and when you suture it, you have more chances of hypertrophic scar and infection, because if the margins are burned, healing will be by secondary intentions from the base, it will not be by the side, and then those healing is problem. So, do not do this. If you want to do this, use blend mode. Company has made, there is one other option, that is called as blend, and there is every generator has a button just near the cutting, and blend is used by the yellow paddle. So, this is yellow area is the blend. So, there are two type of cut, one is pure cut, another is blend cut. Blend cut has a mixture of little coagulation current also, so that it is not a pure coagulation, so that it will cut also and it will achieve hemostasis also. Like suppose you want to cut the muscles of the uterus during the myomectomy, you can use blend current. Suppose you have to cut the some of the liver, like if you want to do the with the monopolar liver resection, you can use blend current, and after blend you have to do fulguration also. What is fulguration? We will discuss. Yes. So, cutting is of two type, one is pure cut, another is blend cut. Exactly same way, coagulation is of two type, one is called as fulguration, another is called as desiccation. What is fulguration? It is also called as spray mode. Fulguration is coagulation from some distance. Yes.
So for monopolar, like we have two patterns, yellow and
Blue.
so if we are using monopolar, if we use the blue one, that is
Coagulation. Coagulation. Blend is yellow only. In machine, you have to change to the blend mode. Blend is a type of cut only. So, it is yellow area. Can you see this? This color is yellow and this color is blue. So, pure cut and blend. No, yellow, if without pressing any button in the machine, if you are pressing, that means it is a pure cut, and in the machine you can change to the pure cut to the blend cut, then the same yellow will become now blend cut. So, this is same yellow paddle will use for blend cut, and blue is for coagulation, and blue also you have the two type, one is called as fulguration. Fulguration is coagulation current from some distance, here the voltage increases. So, what happens? Electron can jump in the air to the tissue, and depth of injury is 1/6 less than the width of injury. So, that even the underlying ureter will not damage. If you have a rectum, rectum will not perforate. That day you saw in endometriosis we were using a spray mode, and the machine was changed to the fulguration, and with the spatula you can fulgurate, that is a spray. Just like if you have to spray this wall, you have to maintain some distance, otherwise you cannot spray. If you will touch the wall with the nozzle of the spray machine, all the paint will drop down. You need to maintain, so that if you want to fountain your garden, you are putting a finger and you are spraying the water all over the garden. If you will put it into the root of the plant, plant will die. A small plant, they can erode, soil will damage. So, that is why always maintain some distance if you are doing the electrosurgical for hemostasis. In cholecystectomy, sometime we separate the gallbladder from the liver, there is oozing from the liver, you can fulgurate the bed of the gallbladder, so that a thin film of coagulum will form, which will keep the bleeder behind, and bleeding is stopped. This is fulguration. Sometime endometrioma in the ovary, you can not remove the wall, you can fulgurate. Sometime in the myomectomy, you can fulgurate. Fulguration is a coagulation current from some distance, and other is called, this is fulguration. In this video you can see This is the spatula and which is fulgurating. This way you can fulgurate all around, and slowly this is a spray mode, and then it will go. So, this is very good current, that is called as fulguration, and it is spraying over, and you can continue, and you can again repeatedly clean it. Do you know fulguration has some very beautiful thing, that it does not have any deeper injury. So, sometime even on the peritoneum, where underlying iliac vessels are there, underlying ureter is there, it is safe. In some of the machine they have made fulguration also two type, one is fulguration, another is spray. So, if it is from little away, it is called as a spray, if it is little nearer, it is called as fulguration, and there is a change in the voltage. Like in Covidian, fulguration is also a spray and fulguration is separate. So, another important is called as desiccation. What is desiccation? Desiccation is coagulation current with the firm contact. Firm contact. In desiccation, you have to catch it. Now, we will discuss desiccation means you catch the tissue by both the jaw, water content come out, protein coagulates, tissue shrink, and after that elastin and collagen of the tissue will melt, melted elastin and collagen will fuse, and the lumen is completely sealed. Now, the fourth drawback of the bipolar. First drawback of the bipolar was it does not cut. Second drawback, for same wattage, same type of current, same timing, if you use, collateral damage is more. Third drawback, every instrument is not available in the bipolar. Fourth drawback, bipolar only desiccates. Bipolar cannot fulgurate also, bipolar cannot blend also, because if it is not cutting, how can it blend? And it cannot spray also, it can only desiccates. Do you know why? Because if the two pole of the bipolar goes near the tissue, tissue does not have any affinity for the electron, because they say tissue in monopolar, once you attach the patient return plate to the body of the patient, the body of the patient itself becomes one electrode. It wants to attract the electron, isn't it? Because ultimately, but through the body it has to go to the patient return plate. So, there is one return plate and the body is attracting the electron from the monopolar, that is why monopolar can spray. Bipolar, once with the both the pole they go nearer, then only affinity is in between the jaw. The tissue does not have any affinity for the bipolar. So, that is why bipolar cannot spray, it can only desiccates. If you have to do the endometriosis with the bipolar, then with the open jaw of the bipolar you have to touch it, open, but touch is required, without touching bipolar does not work. Now, variables impacting the tissue effect. That will not be called as fulguration, that is called as desiccation, because as soon as you touch it, it is desiccation. Fulguration always has to be in the spray mode. Bipolar cannot spray, bipolar can never spray, although as a synonym, as a misnomer, you can say that I am fulgurating, isn't it? But technically you are not fulgurating, you are desiccating. Fulguration word should not be abused with the bipolar. Bipolar cannot fulgurate by its property, bipolar need a contact. Now, variables impacting tissue effect.